Our ASH 2015 coverage continues. I'm Thomas Baldrick. Happy to have with us right now Dr. Francesca Schieppati from the Icahn School of Medicine in New York City. I love coming here and getting all these international names and the challenges of saying them. It's fun.
Yes.
Thanks for being here.
Thank you.
As a young investigator, your research interests are in myelodysplastic syndromes. What attracted you to this area?
Actually, it's a very interesting area for research because we don't have many drugs for these patients. So it's a very challenging area for study mechanisms of pathogenesis. Also because we don't know many things about these diseases, and this can improve research also for discovering new drugs when you know better the mechanism of the disease and all the components, especially the inflammatory component, which I was interested the most and I focused my research on. You can find also more targets for therapies, so this is very challenging.
Let's talk about the poster you presented here at ASH.
So the poster was about the use of IVIG, the intravenous immunoglobulin, for the treatment of immune cytopenias in MDS patients or in general in bone marrow failure syndromes. In these patients in particular, we found that they had a T-cell clone that could be responsible for the immune manifestations in these patients, and so we choose to treatment with an immunosuppressive therapy that could be feasible in these patients, and also that could be combined to their specific therapy for MDS. Like, for example, in two patients we were able to continue azacitidine and treat their immune manifestations with IVIG.
What did you think were the key findings?
Well, the key findings are that the treatment is feasible, and 88% of the patients responded on cytopenia, which is a very good result, and many of them had a very prolonged result. And another good thing was that some of these patients who were on steroid treatment for a long time with the comorbidities related to chronic steroid therapy were able to withdraw the steroids because they benefited from IVIG, which are much less, they have much less side effects. So this was a very good thing. And another insight is that IVIG has been thought to be useful for autoimmune disease in terms of humoral immunity, so autoantibodies, but actually there are evidence that also cellular immunity, so T-cell mediated immunity can benefit from IVIG treatment, and this is a clinical indirect demonstration, so it would be very interesting to do also molecular or more experiments in these patients to see which was the mechanism that led to the response.
Do you see IVIG having an important role for these patients?
Yeah, definitely, yes.
Very good. Thanks for joining us. We appreciate it. Best of luck to you.
Thank you so much.
Okay.